Thank you very much, Soumya, and good evening, everyone. I know you have given a warm introduction about the panelists. If I have to start introducing them, then I know we cannot cover this whole session in 1.5 hours because I'm excited actually looking at the panelists' profile. On one side, we have Sarang, who is an accomplished researcher and an academic in the healthcare space. On the other side, we have Avanthika coming from the CXO suite in the healthcare. And Dr. Sujoy being an administrator as well as a clinician himself. So this is a lot of rich, diverse group that we have today. And I'm excited about the topic as well, because if I look at the topic, it says accelerating digital transformation in healthcare. And looking at the topic and recollecting some of our earlier research work, the term digital transformation by itself is a complex phenomena because we're talking about a change here. We're talking about a change from an organizational perspective. And research shows that more than 70% of digital interventions today fail. And that's quite scary because for healthcare, especially when we have to put investments in digital interventions, it means a lot of money, it means a lot of effort, and it means a lot of planning. Now, when we say 70% of digital interventions generally fail, then this topic becomes an important agenda for healthcare to discuss. So today we will talk about digital transformation as a change, not only as a change, but the complexities involved in through some of the questions that I have to ask our panel members. So let me start asking from a very fundamental question which comes to my mind, because when we talk about healthcare firms going digital, the basic question in my mind is, why do healthcare firms go digital? Or rather, why should they go digital, first of all? Is there any motivation or any factors that motivate healthcare administrators or healthcare firms to go digital at all? So let me route my first question to Professor Sarang to hear his insights on this.
Yeah, it's an important question. And I was thinking of an analogy. The one that came to my mind was the first time smartphones came on the market. And if you asked why, the two different questions that you're asking, why do people buy smartphones and why should people buy smartphones? I think the answers are very different. If you ask most people, why did they buy? They would say, looks like a new shiny toy and I have money, so let me, buy it and play with it, so on and so forth. And then if you ask a, ultra rational person, why should someone buy a smartphone? Then they'll talk about, here are all these apps, and then if you use this app over a lifetime, then there'll be so much improved, monetary position. And so now if you take the investment on the smartphone, this is your return on investment. And hence you should buy a smartphone, like all the petrol that you save because you followed Google Maps and whatnot, right? And I don't think the answer is very different when it comes to healthcare organizations and digital transformation. Based on what I've observed, it's not hard research, but just talking to different people in the industry, it seems there's some excitement. A lot of people are coming with solutions and sort of portraying the virtue of digitization that's driving some of the early adoption. The should answer probably is going to come next in the next wave, saying, okay, let's, now that we are getting into this, are we getting any benefit out of it? What would be the return on investment? I think the should is following, why do people adopt? Yeah. Thanks.
Right. Thank you, Sarang. This is a great start. And let me also hear views from Dr. Sujoy on this. I know, Sujoy, you have been on the administrative side. You would have made decisions about going digital. And also when you respond to this question, if I can request you, Sarang used a couple of terms in his response. He said about digitization, digitalization. Let me add one more to that. So digitization, digitalization, and digital transformation. These are the terms which we often hear. in most of the discussion. So if you can also clarify and unfold these terms with some of your experience and examples, that will be great. Over to you, Dr. Sujoy.
First of all, I have a bit of an unstable internet today. So I'll just, from the bandwidth issue, I'm just going to put my video streaming down. But my apologies if at any point of time, if I get disconnected. So the first thing we have to understand is what is healthcare doing or what is healthcare for? And in many ways, it is to actually provide high quality care with low cost, accessibility, the triple aim that we talk about. And therefore, in healthcare, what is very paramount is standardization, to see it from a standard perspective that we are providing care, quality care at every possible time. And then now when you have the standardization, you also look at a piece where you are looking at the integration perspective, because the standardization and integration done together brings in certain facets of transformation, which is what we call as unification operating model. But if you look at from a digital strategy of an organization, you would see how would they lead to more and more patient engagement, look at how they are factoring in and bringing in digitized solutions within their organization, and then how they are improving the work on their operational backbone, which is the cornerstone of the delivery of care. So in that perspective, if you are able to bring in all the three things together in terms of patient engagement, in terms of digitized solution, and of course the operational backbone, you would have done your first work around digital transformation, or the first need of digital transformation, you have sorted out that.
Right. Thank you, Dr. Sujoy. This is helpful, and you use this term called patient engagement, which seems to be an important term here. But before we move ahead, I just want to kind of update all the audience, spectators of this panel discussion. I can see some of you raising your hand. So what I'm going to do is I'm going to actually have some questions which I have prepared for the panel discussion. First, I'll shoot out these questions to all the panelists. Let us hear them for about an hour. And then in between, if you have any questions, you can just type them in the Q&A so that you don't lose them. And towards the end, we'll have about 20 minutes to pick some of the questions from the spectators and audience. And I can facilitate routing these questions to the panel members. Yeah. Okay, great. So let us get back to Dr. Sujoy's response. He used an interesting term called patient engagement, and that triggers me to next question, probably a follow-up question to you, Dr. Sujoy. So definitely patients are in a great way direct beneficiaries, right? When we talk about digital, when we talk about a change, in one way, patients would be beneficiaries of whatever we are trying to provide as a quality care. Now, if I look at the larger ecosystem of healthcare, there are other stakeholders also. I mean, would you like to talk about those aspects? Like, who are those stakeholders that we should be mindful about when we embark a digital transformation journey from a healthcare perspective?
So when you look at digital transformation, or for any transformation for that matter, the two important things that comes in your mind is one, that you have a legacy system, that one which is already existing, and it could be digital, it could be non-digital, or your operating processes. And the second is, in doing so, what is the kind of change management that you would like to bring in? And my studies that I've done through different organizations and the teaching that I've been doing at 6 years at IIM Calcutta, we have seen that the organizational behaviors in this context comes in three forms: design, culture, and of course, politics, which is a word for leadership perspective. So if you bring in all of these three stakeholders, all these three perspectives to an organization, what does an organization look at from a digital transformation perspective? One, what is their targeted outcomes, the outcomes that would actually reach to the patient? Second, what are their technology requirements that would fulfill those, whether it is an engagement need or whether it is an outcome need? And then, when you start looking at those two factors, then you start looking at data, you start looking at processes, you look at people requirements to bring in all of them together. So my short answer to this, to digital transformation, is to correct it or look at it from the perspective of 5 things: your operational backbone, your shared insights, your platform, your accountability framework, and of course, the final one is your ability to integrate third-party players who can come and help you in improving your organization's digital structure.
Okay, that's great. So you mean to say there are many players and everybody have their role to play in the digital transformation. It's not just about the patients and the administrators, and we cannot close the loop of transformation there. Is that right?
Yes. So from a cultural point of view, you would have to see it everyone within the hospital ecosystem. So you have the physicians, the nurses, the other healthcare workers from an organizational cultural perspective. But when you are looking at leadership, when you are people who are making those decisions which are related to business changes, related to technology changes, and of course, in all of these too, how do you actually put in elements of design into this, wherein you are bringing in certain systems to work for it?
Okay. That's interesting. You spoke about design, culture, and politics. Maybe I'll come back to you to expand more on these 3 in a little while. But before that, you also spoke about some kind of change management that requires throughout the digital transformation journey. That also triggers me to ask this question. Let me ask this to Avanthika. So change management is not a very linear process, right? I mean, we cannot say that, hey, before I go digital, do I need to do some change management, or during the digital intervention is change management required? Or is it post the digital, do I need to do change management? This is a tricky question, by the way. So I know this question requires more examples to unfold it. Working with Avanthika and with little knowledge about the KG hospital and their digital journey so far. So Avanthika, this is the question. The question is, if we have to start a digital intervention as a hospital, right? Now, how do we check whether we are ready for this transformation or not? How do we even assess the readiness from a change management perspective?
So sure. So first of all, I suppose I'll talk about KG Hospital's sort of journey in short to talk about the change. And we are not as big as Apollo. We're older, but not as big. So what we did for the past 4 to 5 years really was to focus on the basics of like getting our basics right, and not think about the fancy buzzwords that are going around, newer age technologies, AI, whatever it is. The reason is because we were simply not ready for the newer age technologies anyway, right? Why? Because first of all, we were trying to address certain pain points, say like patient pain points or clinician pain points, operational pain points. And these required like setting our processes in place properly, first of all. So setting processes in place sometimes requires a technology intervention, like say putting a queue management system in a high volume OP, for example. But not always do you need technology intervention. So we're looking in terms of solving our main pain points first and streamlining our processes. And the second reason we wanted to just focus on the basics is because of our staff itself. Take, for example, our clinical staff. They weren't using technology on a day-to-day basis for their OPs or whatever it is. So the comfort with technology was also not there. And a lot of the doctors at the hospital have been there for longer than I have been alive. So getting their buy-ins, doing that groundwork was really important for us. So getting them to use, say, computerized prescription order entry or scheduling their OTs, the basic stuff that you would need to put in place was important. And also the third thing is technology itself. Like I think it was mentioned earlier, we inherited a lot of legacy systems which needed upgrading. There were a lot of islands of modules which needed to be integrated. Data quality was bad. Granularity of data was bad. So we kind of had to fix all of this and to be even ready for taking on a more evolved system processes going forward. And now I think having done that groundwork, we're sort of in a position where we're doing some AI work with the leading university in the US and doing some research on that. So without that groundwork, I don't think we would be in a position to take IT to the next level going forward.
So if I understand you correctly, you mean to say, get the basics right, set your processes before thinking of technology, and also prepare your people towards change happening. Is it right?
Right.
Yeah. So can you expand a little bit more on the third point? I mean, setting the processes, I think, this is my opinion, that probably easier than getting the people ready, because if you put a set of experts of continuous improvement on your process, look at it from a process improvement lens, probably setting up the processes for technology could be accomplished. But talking about the people, because we know people come from different backgrounds, different experiences, and all of them have different expectations and assumptions in their mind. So how do you generally deal with people? Maybe you can share your experience. What kind of things have you done with readiness from a people perspective?
So a couple of things. One is how we develop the solutions we do. Currently, we do most of our development in-house. I'm not saying that is sustainable going forward with growth and everything, but that has worked in terms of getting buy-ins, because we do a lot of our development agile. We design with the teams that are actually doing what they're doing. And we get their buy-ins early on and get feedback, reiterate, iterate, do multiple tests, do user acceptability tests, and then go live. So that has helped in getting sort of the buy-in. But there's also a lot of skilling and reskilling that we did across the hospital. If there are certain older generation doctors who don't prefer to do something a certain way, then we put in other replacements or other staff to sort of coax them to doing it. But I think it's gotten easier over time. Initial resistance is definitely much higher. And now we have doctors constantly calling us up, asking for different modules and different IT improvements. So that's definitely changed over the years, but it took us a good 4 to 5 years. Yes.
Okay. That's great. So you're bringing in the organizational learning component as well, that as we go on, we get better on digital transformation. That's a wonderful thing. Thank you, Avanthika. So let me now shift gears back to Sarang to ask this question related to a little more about the approach itself. I often hear, Sarang, when we talk to doctors and administrators from the healthcare, that hey, digital is great, but it is expensive. That's what people say. Is it really true? Is digital really expensive, or what do you think about it?
No, I think yes, we do hear about it often. I guess the concern emanates from the way healthcare market operates in India, right? There is, in some sense, the market is nascent. Differentiation doesn't exist to the degree that it would in more developed markets. If organizations are trying to differentiate, it may be, on some services, definitely not on clinical outcomes yet, although you'll see, billboards saying our outcomes are such and such, but not in any kind of concrete manner. So then one starts to look for whether digital will help me to reduce costs, and those use cases may be there, but probably not that prominent. The other thing, I mean, Avanthika talked about 4 to 5 years already in their journey. So these journeys are very long, right? And when you hear about case studies from, again, more developed markets, you will hear 15 years, 20 years, and that kind of, makes people step back and say, am I ready for this? Now, the counter to that, of course, is, you will end up spending those many years doing nothing or just sort of milling around. So, yeah, I mean, like I said earlier, at some point, people have to take a deliberate, planned approach, right? I don't think when people say it's very expensive, they've done a very careful ROI calculations and say it doesn't pass the hurdle rate, right? It's just a gut reaction. If they actually went through some of these, business calculations and then chose their initial low-hanging fruit, the ROI calculation may turn out to be different. Right? There may be a gradual journey. You're not going to, when we say transformation, the mental picture is, throughout the hospital chain, at every place, people are running around, carrying gadgets, etc. That's probably not the right mental picture. You're starting with pockets, showing adoption, showing early wins, and then possibly doing some calculations based on that to convince internal stakeholders, saying, hey, listen, you're not burning money. So yeah, I mean, that's my reaction to the question you asked about. Is yes, it's expensive, but there may be a framing that one could change.
Yeah. That's great, Sarang. I think you use this word pockets of improvement, and if I recollect correctly, Avanthika also mentioned it in a little different way. She said islands of excellence, which can result. Initially, this may be great for an organization, for a healthcare firm which is going digital, to show quick wins to the management, to get the buy-in. Probably the pockets could be excellent. But talking about a long-term digital transformation, what do you think, Sarang, is the anchor that needs to hold this entire initiative together? Is there an anchor? If so, what do you think is that?
Yeah, I mean, one theme that has come out through our, exploratory research on this is, if the entire journey is going to take you, several years, there has to be a theme that is recurring across this journey, right? And so it goes back to this idea of strategy, long-term objectives. And again, as I said in the beginning, if the marketplace is nascent, it means at a corporate strategy level, there is not much clarity. You don't have well-defined strategic objectives or strategic positioning vis-a-vis competition. If you have, then the next question is technology strategy, right? So how is technology going to enable you to be a differentiator on a certain dimension compared to your competition? We find that to be the missing link. Because if that's clear, then people would say, okay, for me to execute this strategy over a period of 7 years, I will start with, who knows, some non-clinical administrative processes first, and I will target those processes that have an immediate bottom line impact. And then in the 4th year of my journey, I'll start moving towards clinical processes in these particular aspects, which will then have. So, I mean, that conceptualization presupposes deliberate strategy, both on the business side and then on the technology side. Okay. Right? That we found to be the usual, I mean, it should help, but that's also the missing link.
Okay, interesting. So there seems to be an anchor then. That means the strategy is the anchor which holds the initiative for the longer run. But at the same time, showing some quick wins can also enable buying. So I think, if I understand Sarang correctly, this process has to happen in parallel right in the beginning, but the latter has to go to a longer maturity as we get experience of the transformation. Right. Okay. Thank you, Sarang. Thank you very much. Now we spoke about why is it important and what are the aspects of digital transformation. Now, if I have to ask more practically to Dr. Sujoy on the how part. So, Dr. Sujoy, you have been the master brain behind a lot of design initiatives in transformation. So, Can you talk a little bit about if a healthcare firm needs to go digital, how do we go about the overall approach of designing the entire initiative itself? Because if we have to translate the strategy into some kind of operationalization, we need this kind of a how question to be answered, right? Can you talk on that?
First and foremost thing, again, going back to the three perspectives, design, culture, and the leadership perspective. So when it comes to culture, one of the things is to have the dialogue with your stakeholders very early on. I think Avanthika was reflecting to that. And I will give the context of Apollo Hospitals. It was always that when we started this journey, say about 10, 12 years back, when we started digitizing some of our system, we had to bring in our consultants to actually into the committees, which would help us to design forms, design how the entire the workflow would look like. And to bring them into the design phase at that point of time is very, very important. So that was that is the step one. And then you would have to give them periodic wins, periodic momentum, because some of these things can be lost over a period of time. To give them a periodic wins, go back to them and tell them what were the gains, where all it had worked, where all there were problems, and then it was sorted out in that way. So those are very, very important from a culture initiative from the perspective. Then, of course, Prof. Sarang was talking about the whole idea of the cost around this. So the leadership, when you take it to the CIOs or the CTOs or even the CEOs of the organization, and of course, most importantly, the CFOs of the organization, chief financial officers, you have to go and put the entire digital transformation budget in front of them. Yes, in the initial first 2-3 years, you will have 120% of what you conventionally used to spend in IT in your transformation journey. But believe me, there is an absolute worth in actually doing this transformation, because in one or the other way, there are many ways that you will be paid back. Finally, in all of these discussions, we should not forget about, or the people who are at the core of it, the patient engagement. And how is it that in an organization, when you are designing a digital changeover or a transformation, that they play a role in that? So that is where you begin to bring in attitudes, that is where you bring in the concepts of behavior, engagement, experience, expectations, which would all then fall in line in the way we do design and systems thinking and improve overall patient outcome. Because if you do a remarkable digital transformation in your organization, but it does not help in overall outcome for your patient, it is meaningless, absolute meaningless. So that is what you have to go back to your drawing board. Design systems, design your programs, your digital transformation in such a way that you believe that you bring in changes in the patient's outcomes or improve the patient outcomes in a positive way. And there are various examples. One of the latest examples that we have been working on lately is actually how you move out from the conventional quality metrics that you have been collecting in hospitals to something which is a patient-reported outcome measurement at home when you engage them digitally in one way or the other.
Interesting. I mean, you spoke about engaging patients right at the beginning, and then it's all about for the patient. So keeping the outcomes in the mind, at the same time, the experience of digitization should be aligned with the beneficiaries. So that's a great loop of looking at the bigger systems from a design perspective. So if I have to ask you for an example, Dr. Sujoy, about what you spoke. So where do you start in these three aspects that you spoke about? You spoke about design, you spoke about culture, And then you spoke about the politics a little bit, right? And I understand completely. Organization politics can play a major role in any of the change initiatives. So where do we start this whole process? Do we need to first start kind of breaking the ice on the politics front, or should we start with the patients on design front? How do we go about this?
We often use the term politics in many more ways than what we normally should. Politics in most of the organizational culture perspective is actually leadership.
Mm-hmm.
It's actually about leadership, how you lead people in doing that. So first of all, it's the decision making that the change that you want to see in the organization should come from the very top, whether from the level of CEOs, from the level of the C-suites in every organization, the medical directors and others, to see that it actually percolates down. And at the same time, they actually help in changing the culture, changing the narratives. Mm-hmm. That I was just a few weeks back, I was in England talking to a group of NHS experts on their digital transformation journey. And they said a very interesting thing. One of the doctors who came on the meeting said a very interesting thing. He said, in the name of digital transformation, what you have actually done is asked us to fill more forms digitally, which is taking more time of ours, and we cannot be now at the bedside. Now, this is not a unique problem that you would normally hear from an Indian doctor. This is a perception that is there in physician community across the world. Now, to actually play around those, what are those kind of a technology that you would build around them to actually help them, assist them? Avanthika talked about AI. There are various solutions, including AI in the daily workflow, which can integrate into a physician to make his or her life easier. And that's why, I know that we are conscious of the time. That's why we want you to come over to this particular course that we are having at ISB about a couple of, 2 to 3 weeks from now. I think it's in the early part of September. So about 6 weeks from now, that's where we were going to have this conversation, understanding from you as well who are participating in this, that what is this conversation that you are having with your physicians? What is the conversation that you are having with your other clinicians like nurses, the other healthcare workers? Are they finding it difficult after the digitization has happened in the organization?
Wonderful. Thank you, Sujoy. Thank you for teasing out our audience about the upcoming program, the executive program on digital transformation as well. Great. So let me move on to ask the next question to Avanthika. So Avanthika, Sujoy, Sarang spoke about design and strategy. And in my earlier questions, you pointed about the various opportunities that we need to look at from a process perspective also, talking on readiness to digital transformation. Now, this question is linked to all three of this. So if there are a set of opportunities in front of me, and if I were to be an administrator to make a decision about digitizing them or improving them, if I have to talk it in a more generic way, for the outcomes which are more favorable for the beneficiaries, patients, then how do we generally make this decision of, hey, how many of these opportunities really need a digital solution? Because on one side, we already spoke about digital can be expensive if it is not done with a diligent planning, with a diligent strategic framework. So this question becomes important and would like to hear your perspective on this.
Sure. So our experience so far is, well, first of all, there's always the constraint of cost. We're not running away from it. It's a trust hospital. There's only so much budget IT gets. So that automatically makes us conscious of what our priorities are. So when we started off, we looked at the big, we focused on certain big wins. And I think I've mentioned before, like we looked at IT in 3 buckets, right? So one is, like Dr. Sujoy also mentioned, was the patient engagement. How can we engage with the patients better, improve their experience at the hospital? One was the clinical part of it. How do we make our doctors, prescribe online, for example, or do their summaries online, like the basic stuff, which would lead to data and get some sort of understanding on data, big data and everything else. And then it was the operations part of it. So starting off, we had to balance all 3. So we did a few of the patient pain points, we did few of the clinician pain points, and then we did few of the operational pieces. And we didn't do, as far as cost, as far as throwing technology at it, as I mentioned, because we had an in-house IT team, we're developing all of it in-house, 90% of it in-house. We had the luxury of having multidisciplinary meetings, having to see, like, does it really need a technology? We're just throwing something at a problem, or is it just a plain operational change that is required? So those decisions could be made in-house. And while I say we developed a lot of it in-house, there were points where we just took up a startup solution and integrated with whatever we had. But that we had to make the case for technology. Otherwise, we were looking at the problems basically, and then deciding if it needed a technology solution or not. Okay. And then the cost comes in. So yeah.
So if I connect it back to what Sujoy said about the leadership aspect of decision making, where you have a group of internal stakeholders who evaluate a case to go ahead for digital or not, becomes critical. That's what you mean to say. Is that right? Okay.
Yeah.
Okay, that's great. Thank you, Avanthika. Now, I know that we spoke about examples of digital interventions in healthcare. Now let me take a step back and ask this question to Sarang. So going beyond enabling some kind of process improvement, Sarang, I mean, I know we can improve the patient experience by reducing the wait time in the hospitals, by using digital prescriptions and things like that, which are healthy signs of digitalization. I don't deny that. But if you have to go beyond that, beyond process improvements through digitization, how can digital transformation change the traditional business model thinking today? What are your perspectives about that?
Yeah, I mean, it's an evolving area, right? And I mean, the way to paraphrase what you're saying is, if we use technology to only do our current business better, then we may be actually under leveraging what technology can do, right? There are so many examples which force us to think beyond hospitals, correct? So a lot of our audience would have heard about real world evidence. What that means is, I write prescriptions. I've been writing prescriptions so that patients can get medicines and then get better. But the data from those prescriptions over a long period of time for many patients is also valuable to pharmaceutical companies who can use that and then appropriate some value, maybe price their products differently or market their products to appropriate doctors, etc. If that is realized, then someone can start a business, right, which sells this kind of IT solution to doctors, to clinics, to hospitals, right? So that is what I was thinking of as technology-led new business models, right? And so on and so forth. So maybe we will start seeing, and maybe we're seeing models where I can provide healthcare, I can take care of patients without having a physical infrastructure. There are pharmaceutical companies that sell, let's say, devices for respiratory illnesses, but the devices now have data collection mechanisms, and so they start forward integrating into patient care rather than just selling their devices and forgetting about them. So there are many such examples, and I think it requires a little bit of mental gymnastics to say, let's not get beholden to how healthcare is delivered today. Let's construct the value chain and then sort of break into pieces and see if I can fit pieces in different ways. And we're seeing it. More of it is likely to happen going forward.
Okay, so you mean to say the focus should also be on leveraging technology beyond the regular process improvements or operation, right? Now, this also puts another question, probably a strategic question on, I mean, what should be my focus now if I were to be an administrator, if I have to look like a, so I run a hospital and there is an importance for improvement using technology in my operational level. There is also a need or probably an opportunity in front of me to leverage it for creating new business models. So should healthcare firms focus on developing new business models or leverage the existing business models for digitalization? This could be a context specific question. I'm not trying to generalize it to one answer, but in your perspective, given that the healthcare, the Indian healthcare system is something which you have looked at in your research. So what should be the key focus here, sir?
See, I mean, it again depends on having a very clear picture of, your market, your competitive positioning with respect to your existing competitors and potential competitors who may come from the left field, right? We tend to overuse the term disruptive innovation, right? But what's the idea of disruption? It's the fact that, many of us may not have heard of Kodak, but we take photographs, hundreds of them every day, right? So if you are in a quote unquote relatively stable market, then use technology to improve your existing business model. But tinker around on the edges and say, what would an organization that does not have the legacy, Avanthika was talking about legacy, that does not have legacy of a hospital, that does not have a legacy of consultant relationships, that does not have legacy of large MRI machines. Is there a way that they could take care of the same patients that I'm taking care of in a completely different manner? And be sort of, have your eyes and ears open. People do this, they will run the hackathons and they will start their own, these incubators and accelerators. That's sort of saying, hey, let's keep our fingers in slightly different pies than the current ones. So I think it's a combination of your current business focus and some forward-looking thinking, how much you're able to do. So again, I think depending on how dominant a player you are, how much cushion do you have, how much you can invest in the future, I think that mix will change. Also capabilities, right? We haven't touched upon this a lot, but a lot of doctors get anxious saying, I don't know AI, I don't know ML. And I think it's important to convey to them that it's okay, you don't know. You don't have to learn the latest, neural network algorithm. But are you able to frame questions which those engineers will find, challenging and interesting to answer, which then yield business benefits? So it's as usual, it's a combination of strengthen your current business, but explore and exploit, some combination of the two.
Interesting. I mean, this is very interesting for me to hear from you, Sarang, saying, hey, doctors, if you do not really know what I'm talking about from a technology perspective, that's okay. Don't get anxious about it. So that's an interesting point. And let me route on the similar lines my next question to Avanthika. Avanthika, I have seen the Harvard case study on the KG hospital. I mean, it's a big transformation that was spoken about in the hospital. And if I have to ask you to narrate some of the experience following up what Sarang said, like, how did you even convince your clinicians for this? Did you really even convince? And is it a worthy effort to put in? Can you speak about your experience from the KG?
Sure. So convincing clinicians, we had champions who did the hard work. So we had some young doctors who sort of, we convinced them, they in turn convinced the colleagues. So that was the easier way of going about this. and once you see a few OPs, a few doctors using it, they're getting the benefit out of it, then automatically the other doctors fall in place. But I also just wanted to add to what Professor Sarang said about new business models, I suppose. We are a very traditional hospital, like, as you know. So now that we're looking at growth, we are starting to think of how we can use a technology first approach to maybe serve, maybe not do radical things, but like complement what we do currently, like say remote monitoring of ICUs or geriatric care, or how do we put in devices for geriatric care. So we're starting to think in those terms, but I don't think that would have happened, say, 5 years ago. Now that we want to grow, we want to, so we're looking at how technology can help us address maybe some low-hanging fruits as far as strategy is concerned as well.
Interesting. Thank you very much, Avanthika. So talking about technology, another point comes to my mind is, see, I mean, this is great because it can serve a great purpose of making lives easier to improve healthcare infrastructure capability to the next level. There is a great possibility towards serving the society in large, because healthcare by itself as a sector has that inherent purpose of serving the society. Now, this is a great part. This is the most interesting part. But if I have to look at the other side of the coin, anything which is new, which is exciting, which can solve a great level of problems, can have another side to it as well, right? So, I mean, if we talk about a new innovation, there could be a set of minds who can think about, hey, how can I use this innovation to do something which should not be done, right? So, and that is why ethics becomes very important when we talk about any new phenomenon. So, Dr. Sujoy, this is a question for you. What do you think, or how ready we are currently with regard to the ethical part of digital transformation in healthcare? What do you think about looking at ethics per se as a topic of importance when we talk about digital transformation in healthcare?
Yeah, that's a great topic, and I'll answer this with the kind of the framework that we designed, and we spoke about it. We speak about it a lot. But before that, I want to make a small remark to what Professor Sarang was talking about in terms of business model. I think organizations, healthcare organizations, if they can figure out their operating model in a correct perspective, from moving from a diversified, unique standalone structure to an unified, integrated, standardized framework, they would have done their journey. And you know, this is where particularly, you know, hospital chains like Apollo or like many other hospital chains would have this as a challenge or an opportunity, where you would have to see that every patient interaction or experience when they come through the doors in hospital A in a location of this city and a location B in the other city, they go through the same. And how the digital infrastructure can help in this, starting from very basic unique health IDs, starting from whether they do not have to carry their reports and films every time they go and see a doctor. You know, when you can actually go in and do that, the doctor can pull that out record and see it in his computer when he's having the interactions with patients. So these are phenomenal objectives changes that we need to look at in operating model going forward in doing this before even we start talking about the business models from a healthcare organization perspective. Coming back to your question, Vijaya, this is very close to my heart in the ethics, and we work very closely with World Economic Forum in framing the questions around ethics in digital health and you know, conversational AI and stuff like that. First of all, from an ethics perspective, we need to see that anything that we do has to be safe and secure for the patients, right? And has to go by the the national laws, regulations, which are there around data privacy, confidentiality, and security. Then whenever you start talking about technology, you have to see how efficacious, how accurate this technology are in actually giving you the insights which are very important in that. What is the integrity of the data structure that you are actually bringing in this technology? That's also very, very important. And finally, 2 points. Of course, this is a broad framework, contains 18 different elements that we have developed. But I want to touch into 2 important aspects to this. One is, how can you make it fair and inclusive? How it happens in a way that you do not let bias setting into your systems. And bias setting into technological systems, whether you are looking at it from an AI machine learning perspective, or whether you are looking at it from a digital divide that is growing in this country and elsewhere in the world, how do you breach those in taking your digital transformation for your organization into perspective? Final question, and this is about a very important point Avanthika picked up, is when you engage to the doctor, it is very important that you build in trust in the system. And how do you build in trust into the system is through making technology explainable. If you are not able to make the technology explainable to the doctor, if the engineer is not able to do it he is not able to explain his technology to the doctor will not be able to explain the technology and why are you giving these values and not these values to the patient. And therein where you would have trust deficits in the system, which is very important to understand from the digital health perspective, not only in India, but worldwide, and address them at the time when you are designing solutions, that there is a flow of trust, there is a flow of explainability.
Interesting. So when you talk about trust, you mean the trust that you build within the system. That means your clinicians, your other administrators, and your patients as well, right? Is that right? Trust with patients. Now, I have a follow-up question, Dr. Sujoy. When we talk about trust with regard to patients, now let us assume a system where we have no digital intervention so far. So there is a service provider, there is a hospital, and there is a set of patients, right? So now there is already some level of trust that exists between these two parties because of their past experiences and several other variables. Now, putting digital into this system, what do you think? Will it create a ripple effect on this existing trust? What do you think about it?
Yeah, that's a great question. And there is a very intense research that is going around the world on this. And this has been looked at more from a human to machine and machine to human handovers. And you will have to look at it in this way, that how seamless this can become. So if you bring in a digital or a machine system or a technology system in between the care providers and the patients or the or the community, how you would see it that you would be able, the human gives an appropriate handover to the technology, and the technology is able to give the appropriate handover to the community or to the patient in a way that it actually is meaningful, in a way that it does not is not unsafe in any ways, and do it in that way. This is an evolving space in research. I think these are very early days to commit anything in this particular spectrum, but would like to see how it evolves over the next 4 or 5 years.
Okay, interesting. So that's a great point. So let me also ask views from Sarang on this. Sarang, any thoughts from you on the trust part of digital interventions? What do you think?
No, yeah, it's an interesting topic, and I'm glad that Sujoy brought this up. Stepping back on the ethics part, right? So one framing of ethics is, let's not allow technology to have harmful effects on stakeholders and their relationship. I think the flip of that is, it is imperative that we use technology to address questions which are of importance. For example, now coming to trust, if we see trust deficit between patients and hospitals, patients and providers, is it not ethical to prioritize use of technology to address that trust deficit by making the system more transparent?
Mm.
Right, so it's again sort of a positive spin to saying not just prevent harm, but do good. I mean, I'm using medical analogy, right? But yes, I think we are doing some research looking at how chest X-rays, which are going through AI algorithms, are being taken up by radiologists. And there we see this interplay between human and machine that Sujoy mentioned, right? And we are seeing very interesting things. How confident people are about their own abilities impacts how they take the results from the AI algorithm. But then this self-perception of ability may be actually completely uncorrelated with their objective accuracy of reading X-rays. Right? So there, I mean, again, there's an ethical dilemma, right? Because then you want to use the AI to augment decision-making of people who are weak in making decisions, but they think they are very good in making decisions. So how do you solve this problem? The second order effect that we are seeing in that context is trust is also, there's a commutation in trust. So radiologists trusting AI is one question, but then the clinicians who are going to see the radiology report, does the trust commute? So this clinician trusts the radiologist has been trusting for ages. And now if this radiologist trusts AI, will the clinician trust AI? So there are these layers which come in. And unless we address these layers, I think AI's impact will probably not be felt to the extent we want it to be.
Right, interesting. I mean, that's a great great way to visualize the layers of trust, which makes things more interesting. Of course, it becomes more complex to manage, but I think as the research unfolds, it will help the practitioners how to manage this whole trust layers and the framework behind it. So thank you very much, Sarang, for that. So let me jump on to look at some of the questions here, some interesting questions from the audience. Okay, so let me route this first question to Avanthika. So Avanthika, here is a very straightforward question to you. How do you sell the need of digital transformation to healthcare executives in your firm? You need to sell it to your own stakeholders first to convince them to draw your investments. But how do we go about it? This is a question from Praveen Shiv Prasad, and over to you, Avanthika.
Sure. So with us, it's a little bit of a different scenario, but regardless, one, if you have a lot of pain points, glaring pain points, either from your patients or whatever it is, you have to find a solution. The solution could come from a technology perspective. That is one. Second, we showed a lot of initial wins. We are a family-owned hospital, but despite that, I still have to fight to get the budgets for technology. So initial wins really help. For example, our queuing system in the wellness center, we got a return on investment in the first 12 months just from increase in numbers, because a lot of corporates started tying up with us because we were more efficient, and therefore we got a return on investment. So those initial wins also help to sort of argue for technology.
Interesting. There is another interesting question here from JP Patnaik, and JP is very clear. He wants to ask this question to Dr. Sujoy. So Sujoy, this is for you. What do you think about the role of healthcare interoperability, the terminology standards and their role in the digital deployments?
Absolutely. That's a great question. And I think, the interoperability standards, FHIR standards, HL6, HL7 standards are very, very important, particularly when you are in the process of integration, when you are integrating with different organization. It could be within your own organization. It could be integrating with outside organization. And particularly in digitized world, you need it. You need coding systems. I see in your questions, you talked about the ICD, SNOMED, and Loenzi coding systems, which are very, very important to actually do that. Because just to give you a context, the last time when we parsed about 1.6 million records, which gives us about 460 million data points, we had trouble, and this was the data from 2014 to 2018 to see how we would be able to bring in certain uniformity in terms of SNOMED city or ICD encoding systems in our way, because we were doing some work on NLP in that regard. And therefore, we realized that to move towards SNOMED city coding within the organization, Loenzi coding, which has been there for almost now 7-8 years for our labs and others, are very, very important in that. Finally, when you start building in solutions from your data and start providing it outside your organization or put it in your digital arm, interoperability plays a very, very important role. And that's where you start giving it to people in the community, or you are giving it to the other organization. That's where you would have to set the standards so that people can talk in the same language. I know that hypertension can be written in 20 different forms in our medical records. So, I completely understand what you are talking about.
Okay, interesting. I can add more to what Sujoy addressed on interoperability. On one side, setting standards right up front for not only interoperability, but also the other parts of digital interventions becomes important, because not everybody in the ecosystem is aware about what we are talking today. There could be a few people who know what digitalization means, a few others may not. I mean, looking at a bigger picture, we have to carry along all the stakeholders in this journey. And I can understand the thinking behind this question, JP. So thank you for that wonderful question. Now, the next question, and by the way, I'm not picking all the questions here, audience, because we have limited time. So I am looking at questions. If they're really questions, but not comments, I'm not reading away your comments. If there are any specific questions, I'm picking them up. And also if there is a repetition between questions, I'm trying to squeeze them into one direct question to the panelists. So pardon me if I am not picking any of your typed up statements here in the Q&A window.
Vijay,
okay,
if I can jump in. So a quick clarification on JP's question. So there's a difference between standards and interoperability, right? In the following way. Standards are necessary for interoperability, but having standards doesn't automatically imply interoperability, right? And there we need to tackle the incentives question, which is, I think, much larger system-wide question of, I use SNOMED, you use SNOMED, they use SNOMED, but will we really create interoperability and share data? Because I'm concerned that then maybe some of my revenue will leak, the patient, I'm sort of bringing down barriers to patient retention and friction, etc., etc. So I think that's a second order, not second order, but a second level of important issue to tackle, I think.
Okay,
thanks. And it's so interesting because, that is where the privacy rules, particularly, Dr. Sarang, Professor Sarang, when we tie up with organizations outside India to actually either validate some of the AI models that we build and all of that, then how do you go about using confidential computing on that data? Because nobody is going to share data with you. We are not going to share data with anyone. No Indian hospital can do it after the privacy laws comes into play. So, so how do you go about that? How do you then do research? How do you do, how you then set up the interoperable standards? So that's what we would have to think through going in future and build it in our systems.
Wonderful. That's great. Thank you. Thank you, Sarang and Sujoy, for more clarity.
A great question.
Yeah, that's a great question. Now, there is another interesting question on the tech savviness itself, not from the within healthcare firm, but from the patient perspective. So here's a question, and let me route this to Avanthika. So this is a question from Ramesh. What do you do for patient engagement? Because many of our patients who are elderly may not be tech savvy. How do you overcome this challenge while dealing with digital on one hand and dealing with non-tech savvy elderly patients on the other hand?
We have multiple ways, and it's true, at least with our patient base, we have seen maybe this is a tier 2 hospitals experience catering to small or mid socioeconomic areas. But it is true, even say, for example, telemedicine, when we rolled it out, everyone rolled it out. We had a basic URL. You just had to click and it will go into the chat screen. So there's no account creation, nothing, just a URL that you have to click. But that was still an issue. So we had to use, say, WhatsApp video calls and then record that and get consent and all of the other stuff, right? So so it is a challenge. We just do it with multiple channels. There's text, there's patient app, there is WhatsApp, there is phone, there is email, there's literally anything that you want to reach us at for whatever services.
Okay, so this also helps me to think through some of the research findings on mobile health, especially while talking about clicking on links that you speak, that there is less intervention of creating accounts. You need not sign up, just click a link and life becomes easier. On the flip side to it is, how much safe is the digital, the data security part of it, the medical records? How much safe would somebody who is not tech savvy perceive this whole intervention, Avanthika?
I don't think, at least from our experience, that safety comes first in their minds. It is more like, I can't, at least we haven't had issues with patients complaining about data being accessible everywhere. And, you know, we do have, well, as a hospital, we are also a little anal about security because of past experiences. So we do have the necessary protocols in place and verifications and everything. But even then, I think the convenience sort of takes precedence over safety, at least with the patients that we see. So as long as they get their lab reports without having to visit the hospital, I think most of them are quite happy with that. They don't really complain too much about safety, at least with us. That's been our experience.
Okay, this being an important question, because we speak about the trade-off between convenience to safety. Let me also hear the perspectives from Sarang and Sujoy. Any thoughts on this, Sarang?
So I'm not a data security, cyber security expert, but you hear two narratives, okay? One is Indians are really not concerned about privacy. So I think the operative word is privacy, right? If someone hears about, you know, that I am here to do this test, that test, you know, you yourself talk about it, you talk about it in open, so people are hearing it. I take it with a grain of salt because I also do research in, you know, diseases like tuberculosis, and they're knowing that you have TB is a stigma. People also have diabetes, for example. You know, I don't feel like telling everyone that I have diabetes, right? But that's one narrative. I think the second narrative is people will start caring far more about their data privacy and security when someone can monetize that data and then it comes back to hit you. Right? I think we are not there yet to that extent because insurance penetration, payers are not, you know, very big. But when it starts to happen, then it'll, you know, so do we want to wait until then to introduce safeguards, or do we start, you know, creating this environment where patients feel secure and safe with sharing their data in a kind of a controlled environment? And again, you know, Sujoy may know more about sort of use of blockchain, that, you know, I will have a token. And so, but I mean, I've heard of a lot of this, but I don't know if organizations are using it already with their patients. Yeah.
It's mostly in the pilots. Right.
Pilots, okay.
Right. But, you know, Vijay, I would say convenience and the perspective of the safety or security, which Avanthika is talking, is actually the same side of a coin. You know, we would have to be on the same side, particularly if you are looking at it from a design aspect, that you design both the convenience aspect and also the safety, security aspect or privacy aspect, as Professor Sarang says, in the same way. You cannot pit them against each other. But the interesting point that I want to, and I want to bring Professor Sarang into this from a holistic perspective, don't you think that digital literacy in India in the past 2 years in every segment of the society, wherever internet could reach, has improved. And if they can see TikTok, they can possibly also take care of their health.
Yes, yes, I hope that's true. I'm not a doctor, but I also hear of this new acronym I've forgotten about, beware of Dr. Google and something like that. But you know, to answer that more seriously, one is digital literacy in terms of being able to use different apps, correct? But there's a second order literacy, which is what do I enter in Google search that gives me the most pertinent information, which then I can ask a meaningful question of the doctor. I think that I still believe I don't see it as much. And it's not only about health. It could be about financial services. It could be about, you know, students coming to me or operations management or anything. And are they doing the right background search? Google has everything, but am I able to extract that information? Possibly more effort need to be taken directly by healthcare organizations to create that kind of a digital literacy among their patients. Yeah.
Absolutely.
Good point.
Okay, thank you very much, Sujoy and Sarang, for this. But I like the question you asked, Sujoy. You said, hey, if you can use TikTok comfortably, then what about talking on security on your mobile health? That's a deep question to ponder, and let the audience think about it for themselves. So let me move on to another question, and this is a question related to a survey which we did last year. So this is from an anonymous attendee, and let me route this question to Sarang. So just to give some background before I ask this question, we had an opportunity at Max Institute of Healthcare Management at ISB to conduct a survey last year to see how much is the digital penetration from a capabilities perspective, digital capabilities perspective in small and medium-sized hospitals in the country. So this question is little related to that. So I will let Sarang answer this question. The question is, only big or corporate hospitals think about metrics or even digitization for that matter. What about the other hospitals, which could be in the rural or in the tier 3? Do we have something to talk on digitization benefiting them as well? So this is a question which could be taking a different directions to answer. So let me hear from Sarang first, what he thinks about.
No, that's a good point. I think common sense prevails to a large extent that, you know, the digital journey will start in larger hospitals, in larger cities, and then will percolate down to tier 2, tier 3 cities. Yes, I mean, I'm not going to discount and disregard that notion entirely, but you will find organizations in smaller towns and cities that use, you know, cleverly use technologies to overcome the handicaps that they may have. And this could be both in private for-profit hospitals as well as not-for-profit hospitals. And that's probably, I'm going back to maybe what Avanthika was saying earlier, is that's because, and also Sujoy, that they understand their operating model better, they understand their pain points better. And they will pick and choose technology that solves, you know, specific problems for them first. So, I mean, it can be done, and there are examples of how it has been done. Probably those stories are not propagated widely enough, because what you hear is typically large hospital chains embarking on multi-million-dollar digital transformation journeys, and then people say, okay, so this is not for me. Probably the answer is far more nuanced than that.
True. And also to add to Professor Sarang's response, and just to share some of our findings from the survey, we found that most of the hospitals in the tier 2 cities or even beyond, there is no understanding about looking at technology as a system itself for a change. I mean, when there were questions about how do you strategize or how do you plan for a technological change, we did not get many respondents even giving us responses to such questions. I mean, so on one side, there could be some level of capability development that can help progress in small and medium-sized hospitals on technology strategy perspective itself, because again, looking at pockets can lead to some level of quick wins, but on a longer term, when we are talking about investments which may demand a bigger change, technology strategy could be one way to look at that. And it becomes more important in small and medium-sized hospitals, because the larger hospitals, the so-called corporate hospitals, may have very strong resource backing, which the small and medium-sized hospitals may not. So in my opinion, I think technology strategy becomes more important here, and that awareness and capability building could be a good effort to put in. Nevertheless, this could be a topic which requires more contemplation to it, but these are some quick reactions to the question. Okay, we can pick another question in the interest of time, one last question. So there are questions about data security. I can see a lot of questions about data security. There are questions about speed and convenience. So we kind of addressed the convenience and the security to some extent, but there is a specific question on speed. So let me ask that. Maybe I can route this to Dr. Sujoy, and Avanthika, you can chip in as we go along. This question is from Digambar Mani. He asked, technology deployment by itself is a time-taking process. Absolutely. Now, on one side, we have many other things to solve. There is patient satisfaction. We are talking about taking our hospital to the next level, top line, bottom line, thinking behind administrators. Now, doing technology, how do we perceive this? Is it about the speed at which I go ahead and do the digital intervention? Does it really make any difference to the overall big picture? Dr. Sujoy.
Very, very good question. I think it's a fundamental thing that we need to look at when we are doing digital transformation at hospitals. How long will it take? I gave an example of Trinity Hospitals Group, which which did it from 1999 to 2009, where they were integrating about close to 30 hospitals at the same time and doing their digital transformation. It took them 10 years. And some of the processes are still evolving in those systems. In India, possibly when we would have those kind of studies done in Indian hospitals, we will understand how much time it will actually take. Avanthika gave a great example of 5 to 6 years that they took into this phase, which is by many means faster than many organizations who would have done it in that way. So you have to take time on your side. I wish we had an magic wand which would transform hospital overnight and with that kind of a flash or a speed to actually move into that. But I go back, and Professor Sarang will smile on this, in the George Westerman's famous saying, which is like, if you do not do digital transformation in the way that you do, you would not metamorphosize from a caterpillar to a butterfly. And what you would end up is speeding caterpillars all over the place. And we're seeing this in many industries. We're seeing this in many organizations. We know how digital transformation fails. So speed is important, time is important, but I think it is also important that what are you going to get the results out of your delivery from digital transformation, which is the main essence of it.
Mm-hmm. Great. Any thoughts from you, Avanthika, on this about the speed of transformation?
No, I would completely agree with the same thing. So I think speed important, but I think we need a clear path about where we're going and what we need at the end of it. And that could change, but I think that clarity is more important rather than getting things done today or tomorrow.
Okay, interesting. I can relate this to an analogy which we often talk in the class about the first mover advantage to the fast mover advantage in a competitive landscape. I remember about what McDonald's did and what White Castle was not able to do with regard to hamburgers. I mean, White Castle was the first organization to come up with this whole concept of hamburgers, though they had the first mover advantage, the speed part of it to get into the market, but they lost it because they did not scale it up with the same speed in which they came up. So McDonald's got that advantage. So if we have to answer this question from purely a commercial angle or from a business perspective, then I would say, hey, speed matters because you are in a competitive landscape. So of course, the outcomes cannot be compromised for the speed. The purpose cannot be moved away far from why you exist as a hospital or a healthcare firm. But alongside all this, speed is a capability to develop in digital transformation. So that's what I feel. We have another interesting question, and this could be the last question from the audience. This is a question about the curriculum on the upcoming program that Max Institute of Healthcare Management at ISB is launching on digital transformation. So let Sarang answer this question. The question is about the diversity of the healthcare space itself, Sarang. So this is from an anonymous attendee, by the way. So the question is, given the diversity of contexts in which the digital transformation is introduced in healthcare organizations today, there is a varied nature of challenges. There is a variety of constraints that different organizations could face. Now, how did you even think of designing a curriculum which could meet of this variety of needs or the diversity that exists inherently in the industry itself? So any thoughts on the curriculum, please?
Yeah. Two-part answer or two-level answer. I think one is, at ISB, not just in this program, but throughout all our programs, we embrace diversity. And we, in fact, thrive on diversity and aspire to have diversity in the classroom. Because if we are able to channel that, that's when most learning happens, right? So we are, in fact, designing for some amount of diversity. It is acknowledged that it's challenging to pack all of this in a short duration program, which we are aiming for, only few contact hours. But the way we are designing this is that the frameworks that we will start with will account for the fact that different organizations use technology to address different business challenges, right? So we gave glimpses of this, like top line, someone will say, cost reduction, someone will say no patient experience. In fact, you will see diversity of approaches within the same healthcare organization in different departments. And so we will start with that. We'll say, hey, what all can technology do? Right? Let's create a map of that. It could be clinical, non-clinical, but then start to look at that map systematically. It's like a portfolio approach, right? And so different organizations then may say, I will invest more on this aspect of the portfolio and someone else in that aspect of the portfolio. Like I'm a very risk-averse investor. I will only, put money in bonds and some blue chip, and someone else will be more risk-loving, so on and so forth. And then we'll let the diversity unleash, right? So then we'll have discussions in the classroom where someone will say, no, we've taken this approach because we thought these were our challenges. And then some others will say, no, we've taken a different approach. And it's our responsibility as faculty to bring out these pros and cons and let sort of people get insights and go ahead and implement them in their settings. I don't think it's a challenge. It's actually, it will be fun.
Yeah, looking forward for all the fun in the classroom for this program. So thank you very much for the wonderful questions, audience. I know you have great questions there. In the interest of time, I'm not able to pick all your questions, but I can see Ashwini Mistry has put out a link here in the chat window to know more about our upcoming program on digital transformation. So please click on the link and try to learn more about the program. And always you can reach out to Soumya or any one of us if you want to get more information about our upcoming program. So quickly, before I hand over to Soumya, a few key takeaways that I learned from this discussion from our expert panel members here. So I can put it into 3 bullet points. So firstly, start from the strategy. Think big, look at the big picture before jumping into digital transformation. Panelists spoke about the importance of technology strategy while balancing the pockets of excellence or the quick wins for gaining the buy-in from the top management. At the same time, if you have to sustain the results, if you have to take it to the next level in the program, it is equally important to have a technology strategy in place. We also spoke about the evolving business models, how organizations can look beyond the basic healthcare processes, the operational processes improvement, Of course, it is important to have continuous improvement as part of the digitalization, but going beyond this could be looking at the business models and how to leverage them using the digital transformation. Thirdly, we can also look at a great level of framework that emerged from this discussion. We spoke about the design part of it. We spoke about the change or the people aspects part of it, how to kind of address the needs of a clinician when we go digital, how to look at the patient journeys when we have to go digital, and other players, other stakeholders in the ecosystem which become important. So looking at the overall journeys of how digital transformation can be operationalized in the real world becomes another important agenda to ponder. So there are more important points that we discussed, but if I have to categorize them into broad 3 areas, I would put them this way. Firstly, look at the strategy. Number 2, look at your stakeholders, processes, people, and enable change upfront, right from all the stakeholders front. And thirdly, looking at digital, not just for the sake of an investment or an ROI, but there is a bigger picture for digital beyond the operational improvements that can be unfolded. So with this, thank you very much, all the panelists, for your patient listening to all of our questions and your responses, which were insightful. So Dr. Sujoy, Avanthika, and Professor Sarang, thank you very much on this note. So handing over to Soumya for the closing notes.